Good day, everyone. You're welcome to tutorial class today. In this short video, I'm going to be introducing us to what we call computer-aided drug design, or normally called CAD, and molecular modeling. Several persons before now have been confused in one way or the other on what CAD actually means. What is it, and then of what relevance is it to different scientific researches, and what are the different tools involved in this, who and who should be involved in CAD and who shouldn't be involved, what kind of researches necessitates the use of CAD tools and what others do not. So hopefully in the course of this video we are going to be addressing some of these. All right. As a way of outline, we are going to be looking at the following outlines. The first one is what is actually CAD. While secondly, we'll be looking at what is molecular docking as a tool in CAD. All right. And then we also consider the different steps, involved in performing molecular docking, uh, including the post-docking analysis. Also, we will be looking at ADMET analysis of prediction and drug likeness property estimation. And finally, we'll consider molecular modeling and lead compound optimization, as the case may be. All right, when we talk about CAD, we're simply talking about findings or developing and analyzing medicines or bioactive compounds from plant extracts or from synthesized products, all right, using computer-aided methodologies, all right. For so many of us involved in different areas of research, ranging from drug discovery, from plant extracts, or synthetic chemists that are continually involved in the synthesis of varying bioactive compounds or potential drugs. All right, CAD encompasses the tools or the use of tools, or methodologies to investigating the therapeutic, properties of these plants or these synthesized products. All right, many of us before now may have heard of, some kind of researches such as anti-diabetic effects of some plant extract, be it root, be it leaf, or anti-inflammatory effect of this plant bark or this plant root and all that, which is not far from, what forefathers carry out in folklore medicines, all right, where a particular root or herb, all right, is being made into concoction such that when a member of the family, all right, is not feeling too well, a cup of this is always given to the person, and in most cases, after a while, such person begins to recover. All right, so it's believed that in that particular concoction, which is actually an extract, all right, because most of them mixes either the bark, the root, or the leaf in an extractant, all right, which could be ethanol, methanol, aqueous, which is water, as the case may be. So at the end, there is a kind of maceration kind of extraction, all right, where the component of those plant extras, upon incubation in this extractant leaks, all right, into the extractant, which could be water, like we mentioned, ethanol or methanol, as the case may be. So at the end, upon consuming the liquid portion of this particular mixture now, these compounds at the end try to exhibit some therapeutic, properties and all that. So it's similar thing that CAD helps you to investigate, but in this case, in a more technologically developed or advanced manner, where a particular plant of interest, which could be a plant bark, plant leaf, or the root, is meant to pass through extraction, all right? The obtained fractionated, all right? The obtained extract is made to pass through fractionation, using different extractant. In this case, you try to maximize the different components of this particular extract, all right, by passing through a fractionation column where different extractants will be, passed through the same extract, all right, enabling the extraction of different components of that particular extract, dissolving at different polarity of the different, extractant. So at the end, the obtained fractions, all right, is further characterized using tools such as HPLC, GCMS, GCFID to simply identify the individual active ingredients or active compounds, all right, present in this particular extract. Upon discovering these active compounds, one will certainly find out why they exhibit the acclaimed therapeutic properties, all right, or effects they do when used in medicines or even in folklore medicine and all that. All right, so we will also consider the use of CAD methodology, as a way of speeding up, the stages or the early stages of chemical or drug development, in a way of guiding and speeding up drug discovery. All right, it's also a reasonable and methodical technique that concentrates scientists' attention, all right, on the most promising chemicals or drug candidates, eliminating a whole lot of unneeded, efforts in trying to carry out such task in the laboratory, leading to a whole lot of trials and error and all that. So the use of CAD actually help to eliminate such kind of occurrences. All right. By way of continuing, we also try to consider what has CAD actually come to do when compared to the conventional way of drug development, which we actually used before the emergence of CAD tools and all that. Yeah, over the years, in the past years, we discovered that drug development involved a whole lot of processes. All right, it involved a whole lot of processes that as well consume a whole lot of years, efforts, money, and all that. All right, from what we can notice here, we discovered that before a particular compound is optimized for uh, drug or is finally developed into drug and sent to the market, you spend over 10 to 12 years doing that, and this most time costs over $1 billion and all that. All right. However, the emergence of CAD, you discover, will certainly or has certainly um reduced that, all right, where you can now have up to just about 3 to 5 years to develop a particular drug. So it actually came to enhance the conventional way of drug development. All right, in CAD we have two basic approaches to computer aided drug design. All right, for those that would actually want to venture into this properly, you discover that in CAD we have two basic approaches, like I mentioned. The first is structural based drug design, which is always called SBDD, and the ligand based drug designing, which is the LBDD. Okay, in structural base, we simply investigate the drug potency or the drug candidacy or the therapeutic effects of a particular synthesized product or a lead compound or active ingredients with respect to a known 3D protein or a known 3D structure of a particular receptor. All right. You get a particular receptor, a particular protein, which is generally called a target. All right. You have your target and you now investigate the interaction of different compounds or different active ingredients or synthesized products of yours against this particular protein. However, this particular protein or receptor or target in quote should of course have great uh, you know therapeutic implication. All right, it must be involved in the metabolism, of what you are investigating, the effect you're investigating. For instance, if you're investigating anti-inflammatory effects, it should be the protein or the receptor involved in the catalysis of the rate determining step, all right, of this particular uh, mechanism. For instance, in anti-inflammation, you discover is the production of prostaglandins, all right, from arachidonic acid that actually leads to the expression of inflammation and all that. So when prostaglandins are overproduced, you discover that there are cases of inflammation to occur. So what do? You tend to inhibit the point or the committed step of this prostaglandin production, all right, which is the conversion of arachidonic acid to deoxidized prostaglandin G2. All right, so if you inhibit this particular step, you discover that it will be shut down. So in structural based drug designing, we get this particular target, which could be protein or receptor or even RNA, as the case may be, and simply do what? Try to, you know, interact that with our different compounds or synthetic or synthesized products. However, in ligand-based drug design, we only have what we call our target. All right, we have our target, which could be our receptor, our protein, or RNA, and using that to investigate, ligands, all right, that could actually bind to, all right, the protein, okay, we have, or the target we have. So in structural base, you have your protein or you have your target, and then you have your ligand, using the ligand to interact with the protein. However, in ligand base, you only have your ligand without a protein. So you use the ligand to sort the protein. So you are eventually using your ligand to investigate the proteins your ligand could actually interact with properly and all that. So that's the two major approaches which applies, all right, in CAD and all that. Okay, also we have few advantages of CAD, which we have indirectly mentioned earlier. One of it is cost effective, it saves time, is rapid, and is an automated process. All right, yeah, it certainly does that. It's also can be used to obtain idea about drug receptor interaction pattern, yeah, which is a whole lot of guide in drug development. Also, it minimizes the synthetic and biological testing efforts, okay, which usually results in loss of trials and error. So what do? You use CAD investigation to, limit some of these, and at the end you have a better output. Also, it minimizes chance of failure, all right, in the final phase, which is actually true. Okay, in the outline, we mentioned molecular docking as a tool in CAD. Yeah, many people have been wondering what is molecular docking, what is molecular docking, all right, who should get involved in this, and where can this be applied and all that. So we consider molecular docking as a tool, all right, or a key tool in structural molecular biology and in computer-aided drug design, all right, which is actually true, okay, because this particular tool aims to carry out a ligand protein docking, okay, which entirely what predicts the predominant binding mode, okay, or pose of a particular ligand within a protein, okay, certainly of known structure or of elucidated structure. All right, so docking will help you to bring a target and a ligand or a synthetic product or an active ingredient together, trying to investigate their predominant binding modes, all right, and then their strength of interaction as well. The strength of interaction of these active ingredients or these synthesized products in comparison to maybe standard drugs or co-crystallized ligands, as we are going to see later. You discover that this could give you an insight of what, the structural binding relationship of this particular ligands and the target could look like, even eventually when developed into drug and all that. All right, and these actually involve few or a whole lot of processes. However, we will come to know about that later. All right. Okay. Before we move to the next, if you look at the right side, you will see a lead compound. This is a compound here. All right. Yeah, trying to interact. This is a pocket of a particular ligand, and these are the amino acids. All right. The active site amino acid interacting with this particular, as you can see, the positioning of the ligand within the active site of this particular protein. So the predominant binding pose or mode, the nature of interaction and the strength of interaction as well gives you an idea of what this is all about. All right, we also have types of molecular docking. Yeah, there are actually few types of that. The first one is protein ligand docking, all right, where a particular target, as you can see, is docked against a particular ligand. All right, you have the complex. This is the protein, and then this is the ligand in the active site. All right, while we also have what we call protein-protein docking. Yeah, where two proteins are meant to dock or are commanded to dock together for a particular purpose. All right, maybe you are investigating the effect of a particular complex in a particular catalysis or mechanism of reaction. So you could actually join or dock a protein against each other, as you can see here. Yeah, in few cases, we also have the third one we call RNA ligand docking, or even RNA protein docking. All right, where a particular ligand or lead compound or active ingredients or even a peptide, a protein, yeah, could be made to dock against a particular RNA of interest, depending on the um, designed investigation or study. All right, in molecular docking, we make use of few tools, all right, depending on the nature of study you're carrying out and the choice of the computational biologist. Yeah, the first tool we have here is the Autodoc Vina, yeah, which most people actually make use of because it's more affordable, all right, and is also very much acceptable in different kinds of study. So there are also free academic versions of it as well for uh, individuals interested in this. All right. So you have Autodoc Vina. Okay. You also have the second one, which is Schrodinger Mistral. All right, which is an extension of Schrodinger suite. Yeah, it also has an academic version where you can make use of as a student or a researcher. All right. Thirdly, we have the molecular operating environment (MOE). Yeah, this is actually one of the sophisticated tools we use here, and might not be found or seen in the academic version of it. All right, but if you can access the full suite, is very important too. Also, we have the Pyrex. The Pyrex is another tool that in most cases is used for, kind of cloud docking, all right, or what they call multiple docking at a time. Pyrex helps you to carry out this kind of virtual screening where lots of ligands are docked against a singular target. And also, we do make use of online servers for uh, docking purposes. Example of an online server is a PatchDock, all right, where you can actually perform docking online. All right, we also have a few steps in molecular docking, which I'm quickly going to, tell us here, as this video is meant to be an introductory video. Yeah, at the end of this, I'm going to be introducing us to a particular series of classes or tutorial. Okay, for those interested in this, it will actually help you, gain some ground and proper understanding of what these different steps are all about and how they are performed one after the other. Okay, the first thing we have in steps in molecular docking is the pre-docking activities. Yeah, these are the activities you carry out prior to docking process. The first is identification of a target. all right, and ligand or compound for docking. Yeah, I've mentioned earlier, you need to take time to identify your target of interest before you commence your docking process. All right, you don't just dock against any kind of target or any protein or receptor. Yeah, your target of interest must play a crucial role, all right, in the mechanism of the disorder or the disease you are investigating. Yeah, it must, most times is actually the protein, okay, involved in the catalysis of the committed step, or what we call the rate determining step of that particular reaction mechanism, of which when you shut down, when you inhibit, the rest of the pathway is caused to, to shut down or to cease. So it's these targets that we actually want identify when investigating any particular uh, effect. We have mentioned earlier something like anti-inflammatory studies. Usually, you um, targets or proteins such as cyclooxygenase 2, all right, because of the role it plays in converting arachidonic acid to um, prostaglandin G2, which is the oxidized form of that will be further reduced in the second site, leading to inflammation and all that. So you identify the target. Secondly, you carry out what we call active site study of the target. Yeah, you need to investigate the active site of this target to avoid binding or targeting a particular wrong pocket in your protein. All right. Most times by default, your for those involved in this already, by default, you might target, you know, due to the tool you're using, the tool might actually target a wrong pocket or a predominant pocket in that particular protein, especially proteins that have more than one binding site. All right, you might not really be able to know the actual site or the main site for drug targeting, all right, if you didn't carry out some level of investigation before that. And to do this, existing literatures can actually enable you to do this. An instance is in cyclooxygenase 2. If you have investigated such target before, you discover it actually has two major binding sites. We have the membrane binding site and the peroxidase binding site. The membrane binding site is the committed step or the committed site of the production of prostaglandin. All right, that's the first step where arachidonic acid is converted to prostaglandin G2. All right, and further reduced at the second site, the peroxidase binding site that has a heme group. So because of the presence of the heme group, the pocket is quite wider and larger than that of the first binding pocket, which is the membrane binding pocket, which is actually a drug target or targeting site and all that. So if you simply carry out a blind kind of study here, you certainly go and you start interacting your or investigating your compound or synthesized product with respect to the peroxidase binding site, ignoring or forgetting the fact that the membrane binding domain is actually where you're supposed to investigate. So trying to carry out active site study will help you curb some of these errors. And in most cases, you might not find out until you are almost done with the whole thing, for those that will even find out eventually. All right, thirdly, you also source the targets and ligands. Yeah, we have repositories, we have, um, you know, uh, sites, websites, all right, or servers where you could actually source for this. Yeah, for your targets, you might have the protein data bank. For your ligand, you might have the PubChem and all that. And then how you go about them, uh, we will introduce you to that later on. All right, after sourcing that, of course, you prepare the ligands and the targets, okay, prior to docking. And then lastly, you prepare a particular file we call the configuration file. Yeah, that will help you, perform the docking process eventually. How to do this, you will find that in our subsequent videos, which we are going to introduce you to afterwards. All right, we also have the docking activity. This is where you carry out the structural or the structural activity relationship analysis of your compounds, okay, or your identified compounds or your synthesized product and all that. Okay, this is where you actually perform the docking process proper, where you must have carried out all these pre-docking activities. The next is now to perform the docking process, by commanding the necessary tools and all that to perform the docking. And then after the docking, you proceed to your post-docking analysis, where you can now visualize the product of the docking. All right, how was the docking done? How were the poses or the predominant positions, or how was their strengths and all that. All right. Usually you would visualize this in the 2Ds and the 3D structure for proper understanding of what happened. And then lastly, you carry out also what we call the ADMET predictions. All right, or what we call the drug likeness property estimation or prediction. Yeah, this is where you find out how the nature of the compound with respect to the properties of a drug. All right, does it meet some of them or does it disobey some of them? Could it actually be proposed for drug development or does it need further optimization for a better product? All right. Um, yeah, quickly, let's look at application of docking. Yeah, few persons might ask why docking? Do we actually need docking? What studies or what kind of study involves docking or requires docking and all that? Yeah, virtually a whole lot of areas of scientific researches are currently involving this. All right, uh, and here we'll try to highlight few of them, while many more you can investigate afterwards. All right. The first is enzyme mechanism studies. All right. You could use the tool or the docking process to investigate enzyme substrate interaction and catalytic mechanisms. Yeah, how a particular uh, target interact with a particular substrate or ligand. Okay, while performing a particular catalysis and all that could be investigated using molecular docking uh, tools. All right, you can also design enzyme inhibitors or modulators for therapeutic purposes, which is what CAD is also all about. Yeah, through molecular docking, you could design inhibitors of a particular enzyme or target or receptor, all right, for therapeutic purposes. Also, for structural based design, we also find out that um, molecular docking could help you in rational design of ligands or drug candidates, as the case may be, based on the three-dimensional structure of a particular target. All right, docking will help you to establish that. Also, it will also enable you to optimize lead compounds for improved binding affinity, all right, and specificity. After docking process, you should be able to, say a little about the compound, about the synthesized product, and how and where such compound or product could be optimized for a proper or a better binding affinity and specificity. All right. Also, other forms of applications here, you might find the prediction of binding affinity, all right, in vitro screening as well, in fragment-based drug design, okay, in homology modeling and structure prediction, you also have that. And it also goes beyond this, including those in toxicity study, all right, bioremediation study, and all that. Docking process encompasses all that, all right, where a particular toxicant is being investigated against a particular, target. All right, you are trying to see how this particular toxicant in the environment affects the health of the occupants of this particular environment. Yeah, you simply use this tool as well to carry out such investigation. All right, as part of our outline, we also mentioned about molecular modeling and lead compound optimization. Yeah, when you finally carries out your docking process, and then you discover that your compound or your synthesized product is actually promising. However, maybe it's not competing favorably yet with already existing drugs, already existing inhibitors. What do? You might have to go further for molecular modeling or lead compound optimization, where your compound or synthesized product is intentionally, you know, built or intentionally uh, raised in terms of the quality, all right? You intentionally increase the quality of this particular compound or product, all right? Trying to increase the binding affinity. When I mention quality, I mean the binding affinity or specificity, or rate of interaction of this compound with respect to the pocket, which is actually a product of what? The binding affinity of that particular ligand against that pocket. So example is what we did here. So you discovered that lead optimization is the final phase of drug discovery. And this focuses on optimizing different characteristics of your lead compound, certainly, such as the target selectivity, the biological activity, the potency, and of course the toxicity potential as well. So these are what you, as a computational biologist, you carry out after your docking process, when you must have ascertained that this product or this compound, could do this and this. You might go ahead to make it better and all that. Example is what we have here. All right. And there are also few tools that can help you do that. Like what you have here, I actually used molecular operating environment for this particular purpose because of how it is built, unlike most other tools. Yeah, here we don't um, blindly alter the structures of our compound, or blindly add for some functional groups to our compound, in a way of trying to optimize that. No, we simply try to locate our compound or product within the active site of our target and try to see the points of limited interactions, and where these how these interactions could be built, or optimized for a better product. As you can see, in doing that, we had to, turn on our R vector. As you can see, these kind of pointings are what are R vectors, which try to show us points of possible interaction, including those that are yet to be to be exploited. As you can see, we can see some whitish patches and some cyan patches. The whitish patches here will always signify the hydrogen bonding, while the cyan are examples of or indications of lone pairs within your active site. So these are one of our major points of target while optimizing your compound. So as you can see here, where my cursor is, you discover there is a particular cyan patch here, all right, which I could cause my ligand to actually do what? Interact with, all right, as a way of optimizing this compound. And this is what I have here. So I've been able to, install what we call a pharmacophore, which is just a sign at this particular point telling my compound why maintaining the normal structure of the compound. I'll tell the same compound to do what? Kindly make sure you interact at this particular point, or you extend to this particular point, in a way of trying to uh, get a better product of my uh, compound. So this is what we have here. And then in the next slide, you discover that, yeah, this is the normal compound, why this is my model. You discover that the rest of the compound, the rest of the structure of this particular compound is the same as in this. However, this extended portion of this compound was made to make an interaction at this cyan patch. Just like you can see a cyan patch interaction here, you can see one here, and all that, you can see one here, which is exactly what is happening here. Whereas this is still limiting, so I had to uh, quickly exploit this particular point of interaction and see how this could get better. All right, okay, let's see what happened after this particular optimization. Yeah, so when we look at this, actually, all right, anti-malaria drug I worked on in the past. All right, so you discover that upon optimization, the binding affinity of the model was certainly improved. All right, the model has, uh, began to bind with about negative uh, energy of 12.1. All right, while the normal compound or the original compound is giving us negative 10.9. However, when you compare this to existing anti-malaria drugs such as artemisinin, which has 8.9, you have lumefantrine, which has -9.4, artemether this. Even when a combinatorial therapy was performed, yeah, I had to combine artemether and lumefantrine here as well, and at the end we still find out it's having about 11.9, which is still lesser than the optimized product and all that. So this is what led compound optimization or molecular modeling could, result to. All right. As you can see, when this is located in 3D form within the active site, you can see this is the optimized product, while this is the original compound. You can see the original compound and its limited interaction. You can see the optimized compound making more interaction, causing or forming a beta inhibitor of this particular protein when compared to the other. This is actually a plasmepsin protein for those that have worked on this. All right, quickly we look at the pharmacokinetics and ADMET prediction. Yeah, most people do wonder or do ask what does this actually means. Yeah, after investigating the therapeutic properties of your compound, it don't just end by ascertaining the binding pose or affinity of your compound with respect to a target. You also need to carry out or investigate the pharmacokinetics and ADMET properties of it. All right, the drug likeness properties of it. Like we have earlier mentioned, ADMET means the absorption, the distribution, the metabolism, excretion, and toxicity property of a particular compound. Each drug candidate will always have these properties. So you need to investigate that and be able to say, oh wow, this has good binding affinity, they have good binding pose, and they also have good drug likeness properties and all that. As you can see by a table at my right, this is an example of a study I did not long ago, all right, where a particular compound, I titled compound A, all right, from a particular product or particular plant is investigated um, against a standard drug, ibuprofen. All right, so you can see the phytochemical properties, you can see the drug likeness properties, and you can see the pharmacokinetics properties. So this is an excerpt or an example of the table that helps you to um, summarize the nature or the drug likeness property of your compound or your synthesized product, all right, which needed to be attached to your work as well after performing docking and all that. Of course, when you go through that, you see the different properties of this particular compound. Okay, lastly, I might also wish to introduce us to what we call molecular simulation. People might wonder, are they actually the same thing? All right, molecular docking and molecular simulation. However, they both are important tools of uh, CAD or computer-aided drug design or discovery. All right. However, in molecular docking, you are simply investigating your compound or your product, synthesized product, against a rigid body, all right, against an elucidated 3D structure, rigid 3D structure of your protein. However, in molecular simulation, you do this in an environment that is flexible, all right, in a moving environment, trying to replicate, the nature or the environment of the system. So normally, after molecular docking, when your compound is promising enough, you are supposed to pass that through a simulation as well to further establish few things concerning the same compound and interaction for a more informed drug development. So we discovered that molecular dynamic simulation predicts how every compound in a protein or other molecular system will move over time, all right, based on the general model of the physics governing interatomic interaction, of course. It's also one of the most prominent drug discovery tool in science and engineering, widely adopted in the application ranging from drug discovery to what material design. Of course, the fidelity of the predictions of molecular simulations hinges on the reliability and accuracy of the chosen force fields as well. So when you get into this, you discover about force fields and how these, all right, play a great role in uh, these kinds of investigation. An example is what you are seeing by my right. All right. Indirectly, I've mentioned the difference between these two. Yeah, they are actually different. All right. They're actually different. In molecular docking, you don't carry out the interaction in a moving environment, all right, or against moving atoms and all that. While in simulation, you do that. So docking is like a preliminary step to investigating your drug, like drug nature or drug candidacy of your product or synthesized compound. So what do you do after your molecular docking when you have identified your lead compound, all right, or have optimized it? You could go ahead to simulate that to find out about the final product, which will certainly inform your choice um, afterwards. All right, by way of conclusion, molecular docking and simulation have greatly, impacted several fields of scientific research. Okay, so and as such should be optimized or optimally maximized, all right, globally for an improved research outcome. Certainly, CADAS and molecular docking tools or computational biology tools has, room to find several roles to play in different kinds of researches, ranging from macromolecule investigation, structural investigation, interaction and all that. There are a whole lot you can actually do using these tools, all right, which the more you come to make use of them, the more you actually find out where more can actually be applied. All right, this is a way of saying thank you to you for listening. You can quickly contact us through the above link. However, in the description of this particular class or this particular video, you are going to be finding a link to our channel, all right, where we've highlighted or where we've uploaded the stepwise procedures involved in CAD related studies or CAD researches, all right, how you personally can as well carry out what your CAD studies, all right, with the tools involved. Whichever tool that you also couldn't find there, you can actually reach out to us through the details here, and we could provide you with the necessary tools. However, do not fail to subscribe and hit the notification button for the channel to be updated as soon as a new class or a new tutorial is posted there, which we do uh, twice to three times every week, just to keep our students on their desk and make sure they are actually learning and improving on daily basis. So uh, see you as we learn together and get this better. Thank you so much and see you in our next video.